Everybody, today is a special edition of our podcast where I'm going to be interviewing a guest. So this is Dr. Luc Mahler. He is the owner of the Movement Company here in the Glebe. He's a chiropractor, and his facility employs several other different health professionals, including massage therapists, physiotherapy, and a strength conditioning coach as well. So it's a very well-rounded facility to meet all of your rehabilitation needs.
Sweet.
All right.
Like
So what's going to happen today is Dr. Luc is actually going to perform an assessment on me, and then we're just going to kind of chat and
Sweet.
try out a different podcast format.
Just another day in the office.
Yeah, exactly. So Luc, why don't you kind of explain your process and what you kind of look for?
The clinic's called the Movement Company, and that's not a haphazard thing. It's because we believe that movement tells us a lot and solves a lot of issues. So the way you move tells us why you're hurt, and what we get you to do movement-wise will help you get better. Our screen or our assessment starts with a global movement screen to figure out what's working well and what's not working well. And then from there, we would take you to one of our tables and kind of deep dive the problem area, make sure there's no red flags. But we'd start with a history. We'd chat about what brings you in, what your goals are, what your fears are, that kind of stuff. Make sure that we're aligned in where we want you to go and where you want your health to go.
Yeah.
So you're feeling healthy today?
Perfect. Yeah, I feel great.
No major injuries I should know about?
No.
Okay, sweet. Let me grab my doweling here. So step one, this is going to be the awkward version of movements that you do on a daily basis. The awkward version so that it draws out the things you do well and the things you do less well. The first one's going to be a squat. You're going to take doweling, press that guy overhead, and you are going to squat as far as you can. We're going to do 3 times.
Okay.
So feet point forward, shoulder width apart.
All right.
Nice. So you have really good range of motion, especially compared to a lot of the runners and cyclists that we treat. You get a little bit of feet wanting to externally rotate, not the end of the world, especially because it's bilateral and symmetrical. And in our line of work, symmetry is a beautiful thing. So I'd rather have 2 joints that move equally poorly than 1 joint that moves amazingly and 1 joint that moves less well. The next one is going to look at kind of unilateral stance, or how you stand on one leg. You're going to take that doweling and you're going to set it on your head. Yep. Excellent. And then from there, you're going to stand on one leg. You're going to come up past your knee, tap in front of you, and then come back. So we'll do 3 on one side and 3 on the other. So this tells us a lot about what happens when you walk, what happens when you run, what happens when you need one leg to be stable and one leg to be mobile. So here we look for things like ankle instability, knee instability, what happens on the same side hip, what happens on the opposite side hip. And generally you have pretty good balance from right to left. So that's really nice to see for you. You're not getting any kind of hip kicking out or anything like that. Step 3 is the lunge. So you're gonna take that doweling, here I'll show you, and you're gonna have it touch your head, mid back, and low back like this. And then if my left arm is up, my right foot will come forward, and you'll do an inline split squat.
Okay.
Yeah. Yeah, it's a skill testing cardio day. Yeah. Perfect.
Opposite.
Yeah.
All right. So just
Yep. And you go all the way down. You're going to do 3 of those on that side. And here we get to see what happens when you connect the opposite shoulder to the opposite hip. It's kind of expanding on running and walking. It gives us a lot of ideas of how that all connects, how you control your trunk, your spine, all that kind of fun stuff. So generally you do a really nice job standing up nice and tall, and your knee control is good. You're not dealing with a lot of kind of valgus knee movement or inward knee movement. Oh no, not too shabby. Yeah. So that's all we need.
I better pass. Being a trainer, I better pass.
Yeah, exactly. Yeah, you'd be surprised though. Do as I say, not as I do mentality. None of us are perfect. The next one would be shoulder range of motion.
This is where the problems will start.
Yeah, okay, perfect. Finally, you're going to reach up and over with one arm and down and around with the other, and you're just going to let them fall where they may. You're not going to cheat them together.
I guess I'll face this way.
It's easier to see. Excellent. And then we use our handy dandy measurer. So you're relatively symmetrical, but that way you definitely go a little further in internal rotation. Good. Good. The next two, you'll probably want to get on the rubber platform because we're going to test core stability in both the frontal plane and the rotational plane. So the first one is the awkward version of a push-up, everyone's favorite. You're going to start laying on the floor. We're going to put your hands kind of jawline and you're going to push up once. Yeah, so you'll start there and I'll place your hands kind of right there. Yep, and then you're going to do one up. Nice. Yeah. All the years of training and training yourself paying off. Let's do one more.
One more?
Sweet. So this one gives us a lot of ideas. People that do this poorly, they do kind of that kind of stuff, right? They sag through their spine, or they just can't even generate the force to get up. So then we move the hands down to get into a position that's more reflective of an actual push-up. We wouldn't do reps like this, but that's going to be that one. The next one is the rotation. So it's an awkward version of the bird dog.
Yep.
So you're going to go same side bird dog.
Okay.
Yep. There we go, a bit more challenging.
Yep.
Finally, we've got some stuff to work on. Excellent, nice. And one more. Good. Yeah.
I never do the same side version, so.
No one ever does. It's part of what makes it challenging.
Yeah.
This side's much better though. So again, when we were talking symmetry versus asymmetry, having the ability to draw some of that out. So when you're on your right side, you're able to connect those dots much better than on the left side, where you figured it out eventually, like the athlete, and you came through and you figured it out pretty quickly. But if we're looking at places to start, rotational stability would be one of the places we'd look to start. From there, we take you to the table. This is going to start to look a little more like a traditional assessment that you might get at a lot of clinics, but we're going to hone in on a few target areas. So you're going to lay on your back for me. We're going to check in with how the hips and shoulders are moving. So you're going to take this leg up and try and kick yourself in the face. We're going to take a look at that. Good. And then you'll do the other side. Excellent. And then I'm going to feel your low back if you're all right with that. We're going to see if your low back is contributing to your hip mobility. So go again. And definitely. And then go again. So on this side. So what the camera can't see, but we can feel, is that you use your low back paraspinals, the back muscles, to generate some hip mobility. Not the end of the world, but not what you would call textbook perfect. We like when hips and hamstrings don't require a lot of back help. We can take you with hip range of motion. That's pretty darn good. You have really good adduction, and then we would do that on both sides. We'll try not to block too much, but we want symmetry. Symmetry is a beautiful thing. Yeah, there we go. And that's pretty darn symmetrical. Check in with shoulder health as well. Part of this, we're going to check to see how much trap generates the shoulder mobility. One of the things we see a lot is that when people have poor shoulder health and control, when they internally rotate, they use their upper trap to create more movement. You're not too bad on this side. On this side we get a little more, but generally not too bad. I'm going to have you sit up and face this way.
Okay.
And so then we'll check shoulder rotation here. So you'll go like this, rotate up, and you'll rotate down. Yeah, you get just a little bit, but again, pretty symmetrical, maybe a little bit more on your left. Are you left-handed or right-handed?
Right-handed.
Okay, sweet. And then if you go up and over.
Like that?
Yeah. We'll just check that again, good. And then on this side. Excellent. The other thing we want to check with shoulder health is what they call the scapulohumeral rhythm, or how your shoulder blade and your shoulder move together. And then you're going to do the same thing, kind of up and over, like you're itching the top of your head. And that's probably a little faster than what they would put in a textbook. And this is where some of these rotational differences are coming through on the bird dog and things like that, where you've got, again, not something we can necessarily show on the camera, but the back muscles in your thoracic spine, the thoracic paraspinals or erector spinae, are much more hypertonic, tight, ropey versus the left side. So that's how we get some of these asymmetries that pop through. And then we see kind of left low back not as relaxed as right low back.
Right.
So this kind of cross body shoulder to hip pattern that we have happen across our body in front and back, we see that coming through here, right? Where we're getting right shoulder, left low back, just not moving the same as left shoulder and right low back. Yeah, so for us, that's what we would start attacking first is that pattern. Mm-hmm. Way we would do that, or the way things would progress from here, is that you'd spend some time with me doing some hands-on work on the table. ART, Graston, adjustment, etc. Depends on you, your body, and what you're comfortable with, of course. Mm-hmm. Especially in kind of mid-back and some of the parts of the neck, an adjustment can be warranted. It's not always warranted in the low back. Depends on the case. So it's a tool. It can be a polarizing tool, but it's a tool that's part of the tool belt.
Yeah.
So from there, we do our hands-on work. We get the body relaxed. We get those muscles that are working overtime to quiet down. And then we can move you to Lloyd's office, his joke. And in his office, you would do a lot of the rehab stuff that we would plan. So him and I would chat. We'd use his expertise as a strength and conditioning coach and my expertise as a chiro with a rehab slant, and we would put our brains together to create a plan that you would practice here and that you would take home. One of the things that we believe here is that there's two parts to most injuries, almost all will say, musculoskeletal injuries, body injuries. There's this muscle that's working too hard, often the one that's causing pain, and then there's the muscles that aren't doing enough, and we need to rebalance the equation. So if all you do is just the hands-on work, or just stretch, or just adjust, then you've missed half the equation. If all you do is the rehab stuff, or just activate, you've also missed half the equation. So our philosophy is we blend them together.
That's a great reason why rehab in the chiropractic or physiotherapy world merges quite well with the personal training world, right? Because I find that with a lot of my clients in particular, especially when they get sent to me after having gone through like a rehab program, a lot of times they don't understand that that's only like maybe half of the full process, right? Just because you're out of pain doesn't mean you're fully healed. There's still that extra little bit of strengthening that needs to happen before you're kind of like back to normal. And the great thing is, especially for people who haven't done personal training or strengthening, we can get you back to even stronger than you were before you were injured, right? So that's always pretty cool to see.
Yeah. I think that's crucial. We're firm believers that it's basically a continuum. You're either at 100% and you're just building and optimizing performance, or you're somewhere along the line towards healing an injury. And there's a lot of different spots where people find themselves, but generally they come through the door here because they're hurt. That's how they end up in our world. So they're in that kind of initial heal injury phase. Now, we know that most people fall off once the pain goes away, but we know that's just the start of the work, basically. And so then phase 2 is to build some resilience, which is kind of the blended world between your world and our world, where we're looking much more heavily in the strength and conditioning stuff, the movement control stuff. We're starting to add some weight. We're starting to build up some resilience, because one of the stats that we live by is that the best predictor of injury is a previous injury. That can either scare the you-know-what out of you, or it can motivate you. We choose to let it motivate us so that we can make you better, because we also know that if you have an ankle injury, if we work on your ankle, you're less likely to have an ankle injury.
Exactly.
So we let it motivate, and then we move you towards optimizing performance. But generally there's that drop off like you're talking about, where there's this weird kind of in between where you're not quite ready to be back doing whatever you love at 100%. But you also don't need to just like sit around and do nothing. So that's where I think we can work together really nicely, with communication, and just be, Tommy needs to do this, but maybe a little less of this, and you guys are telling us what you're seeing based on how that person's moving, and we can really have a blended approach. To me, that's where the magic happens. That's where it gets fun.
That was great having gone through that assessment with you, because the assessment protocol that we follow at Freeform is fairly similar. We assess how you're moving, and for you, when you're sending your patients off into the world, how important it is for you to kind of like trust that they're getting the proper training afterwards.
Well, I mean, I think it's crucial, really. Like anytime you kind of let someone go, ideally, we want them to not get hurt again. That sounds obvious, but it's important. Like, we see what happens when people get hurt. We're lucky here that we treat mostly active people. They have things they love doing outside of, their 9 to 5. And so they're motivated to get back doing that. But we've seen what happens when they don't do it. They're hurt, they're unhappy, they're removed from their social circle. They're not able to do what they love. They're just not the best version of themselves, which gets into the hokey kind of kumbaya stuff, but it's super important. Like, you take me out of my sports, I'm miserable. Just ask my wife. I suck. So we want to get them back to that. So then part of sending them back to working with people we can trust is knowing that they're in good hands, that they've got people that'll motivate them, yes, but also people that'll slow them down, that'll work on the nitty gritty, the stuff that's less sexy, the stuff that really makes you a better mover though. So it's important, especially if we're connecting. Like we want to send people off to people we know that we can have conversations with, that we can trust, that we speak the same language.
Oh, that's super important.
Are top of mind.
Contrary to popular belief, you don't necessarily want to keep seeing your patients like over and over again, right?
Yeah, I mean, I think that, the definition of insanity is doing the same thing over and expecting a different result. So that's not to say that there's no place for maintenance, just like maintenance is important in any sort of setting. There is a place for it, but we just don't want to drill away at the same problem and try and reinvent the wheel. Too many times the amount of effort that's put into fixing a problem just isn't on a high level. I just think that it can be done better. I think that it needs to involve multifacets to fixing a problem, and I think that you need to have solutions that you can take home with you, right? Like you need to have tools in your toolbox so that if you feel something, the first thought that comes to mind isn't necessarily like, I need to go get X, Y, or Z treatment done. It's like, oh, I felt this before. I'll use this stretch and this activation because I probably stopped doing them because I was feeling good. And I'll start doing them again. And then, oh, lo and behold, this stuff actually works. And then I'm back to feeling at 100%. So, one of the best compliments we can get is when someone says, we gave them the tools to take care of themselves. And doing so kind of, like they'll say like, you lost business, and it's like, well, that's the point.
Exactly.
So that's the point, and it's the best compliment we can get. And so hopefully we can set our patients up with tools that they can use going forward that can complement the work that they're doing in the gym, or the work they're doing with their running coach, or the work they're doing with whoever, so that they stay healthy. And at that time that they're spending with you, they're not being like, well, we need to stay away from this area because this hurts. You guys can really jump in head first and push them to hit that next level.
So let's just switch gears a little bit here and kind of like talk a little bit more about you.
All right.
So what's your background, and how did you get into being a chiropractor?
So I grew up in Huntsville, Ontario. I grew up playing a ton of hockey when I was young. I would say that hockey was my first love. I grew up to a mother who was from France, so she didn't know anything about hockey, but I just kept bugging my mom to put me into hockey. She finally did. And I just went head first on that. But I think in doing so, it really established that I just like sports. I like human movement. I like all of the things that go along with pushing yourself to be better. And so then when high school ended, I thought human kinetics makes a lot of sense. It'll give me 4 years to figure out what I want to do with my life, and I'll follow studies in a field that sounds fun. So I did 4 years of human kinetics at Ottawa U, which is how I ended up in Ottawa. I really fell in love with the city. I got really plugged into the cycling community, started road racing. I had been mountain bike racing previously at a relatively high level, started road racing here, and just found this amazing community of riders that Ottawa has. I think the people that are in the city know how many good people are in the Ottawa cycling community, but it's maybe a bit of a hidden gem. So I found that. I also ran track and cross country at Ottawa U. So basically the endurance world is my world. It's a world that I know and like, and so we treat a lot of endurance athletes because of that. After undergrad, I was working at a bike shop in town here, and the guy asked me the question that everyone hates when they don't have a good answer: what are you going to do with your life? I was like, oh, I don't know, man. And he's like, you should go shadow my friend Dwayne, and Dwayne's another chiro in town here who has a similar mindset to us in terms of treatment and philosophy. So I went and shadowed Dwayne and thought, man, this is awesome. He had it figured out on so many levels. Like he walked to and from work. He had a great practice of people he liked to treat. He still had time to ride his bike. Like all of those boxes were like, well, this looks pretty sweet. So I went to chiro school in upstate New York, got a good education, got my ducks in a row, and really kind of leaned into the sports chiro realm, which had evolved beyond just the hands-on stuff. I think sports chiro first started with just kind of like ART and adjust, ART and adjust, ART and adjust. And we've seen it evolve to also start to include rehab and stuff like that. So that's a fun progression for us because I think it's a better treatment, first of all. Like, I think you get better outcomes, which is important. But it's also just more stimulating brain-wise, where it's like, okay, you've done the hands-on stuff. Now what's going to help them move better? So I did a lot of work, continuing education in that sense. And started my career in the US, but realized that I wanted to come back here, be a part of the Ottawa community, and had an opportunity to do so in 2017. Yeah, so in 2017, we opened the clinic in the space we're in now. We're actually coming up on 5 years in November, so
nice.
That'll
Congratulations.
be a nice little milestone. Yeah, November 15th, which is crazy. Time flies when you're having fun. But yeah, and like I said, we just kind of leaned into being a part of the Ottawa endurance community. It's a community that I know and like, and it's been pretty good so far. I've been lucky enough to work with some high-end people in terms of sports performance, a lot of weekend warriors that are still chasing that kind of like next target, which is also amazing. And I guess the pinnacle, last summer I got to go to Tokyo to be a part of the 2020 Olympic team with the Canadian road cycling team. So
cool.
That was wild. It still doesn't sound real when I say it out loud, but I was there. It was an amazing experience. That's my life in a nutshell, I guess, professionally anyway.
Cool. What year did you graduate from Ottawa U?
Ottawa U. I graduated in 2010.
2010?
Yeah.
Oh, okay.
Yeah.
I graduated in 2008, so we were kind of we were there.
Yeah. You're the one teasing the underclass. Yeah. I remember you.
Oh yeah.
I'm just kidding. Also kin.
Yes, human kinetics. After undergrad, graduating in 2008 wasn't the best time with the recession. And, as you know, the human kinetics degree by itself doesn't really do much.
It's an expensive piece of paper.
Yeah, exactly. Yeah, I decided to go do more school. So I went and got my master's in sport and exercise psychology at Ottawa U as well.
Yeah.
So we were there at the same time. Yeah, so now let's move on into maybe sort of dispelling some chiropractor myths, because there's a lot of them. So the biggest one being that spine cracking.
Yeah.
And I get this a lot because, whenever I work with clients, a lot of times they show up telling me they did something to hurt themselves, right? And I always try and refer out because, I have to know my boundaries. And whenever I suggest that they go see a chiropractor, they're always a little hesitant because they're like, oh, I don't want to get my spine cracked and all that. But we know that's not.
It's not all we do.
Not all you do.
Yeah, the cracking or the adjustment or the manipulation or whatever you want to call it, it's just one tool, right? So is it a powerful tool? Yeah, when it's used in the right situation. If it's your only tool and if you've only got a hammer, everything looks like a nail, or you don't have a nail, you start hammering away, then that's where I think you get yourself into trouble. So for us, it's one tool. It's not something we have to use. The table you're sitting on has different forms of adjustment in the form of drop tables. So the table itself will kind of drop away. It's a less aggressive form of adjusting. And the biggest thing is knowing when to use it and when not to use it, right? I mean, like it's not necessarily knowing, it's really just knowing when to use it is the key, and giving people options. That's why we do hands-on stuff. That's why we do exercise. There's a time and a place, and then there's a time and a place not to use it. The noise, that's the big question often, is what makes the noise. It's just gas coming out of the joint capsule. It's actually not even really indicative of a good adjustment. Sometimes you'll get great movement in a joint that doesn't make much noise, and sometimes you get a ton of noise and it's not even quite right, the right spot, right? We want to get the joints moving again. The biggest goal, or the only goal that we know happens time and time again, that they can prove in controlled research, is that when we adjust you, we increase range of motion at the segment. It's just like cracking your knuckles. You'll feel it happen instantly, where if you crack your knuckles, all of a sudden the joint moves better. Same thing happens in your neck, in your mid back, your low back, and your foot. And that's the goal. That's what we want. We want to use it to increase range of motion in the spine. And then from there, we can take that, we can blend it into the rehab, and you can take advantage of that time when your spine's moving well.
Yeah, and the noise thing, it's the same thing that happens when your knees or your shoulder cracks. It's just
joint.
gas. Yeah.
Yep, any joint. Yeah. And so it's really important for us that people know that we're not expecting it to do anything more, anything less than that. Now we know there's a whole bunch of physiological things that happen. Once we get the joint moving well, there's a lot of really nice things that happen in terms of kind of blood flow and relaxation and all those fun kind of buzzwords that people talk about. But at its core, what we're trying to do with an adjustment in this office is increase range of motion at the segment. And it's the fastest tool that I know for doing that. So it's just a matter of using it in the right spot.
Yeah. And if somebody is like super hesitant, they can say no.
Of course,
right?
yeah. It's your healthcare. Yeah. You're the ultimate decision maker for your healthcare. In my opinion, my job is just to deliver the facts as to what I want to do and why I want to do it, and then it's up to you to say yes or no. Like there's ways to work around it. There's ways to complement it. There's ways to break it in easy. Like I said, there's different ways to deliver the same outcomes.
Yeah, because when it comes to overcoming pain or injury, that trust factor is super important as well, right? So if you're going to be hesitant, even though you may know that it's safe, like it's not productive at all to do something on somebody who's not going to, be afraid or is hesitant about it, right? So
we want you to be bought in as a patient, be skeptical, ask questions, and make sure you're on the same page as your healthcare provider. I think that makes sense across every profession and every bit of healthcare. Like, ask the questions, ask the questions you've got. We like questions here. Like questions are where we understand where people are coming from. It's where we get people to buy into their treatment, to believe in the outcome, all that kind of stuff. They start with questions. So ask the question.
Those are the two main sort of myths that I get a lot from the clients that I see. Are there any others that you tend to get a lot?
Well, I think the big one, you kind of touched on it, was the whole like, you got to come back 3 times a week for the rest of your life. And we simply just don't think that's accurate here. So we want to get people on a treatment plan here because we have so many great providers across a bunch of different disciplines. We proactively blend those in, right? So in our second visit, after we treat you and assess you in visit 1 and visit 2, we sit you down and we explain to you what we found and how we plan on fixing it. And part of that involves our physio, it involves our massage, it involves our strength and conditioning person, and using their skill sets to complement all of the work that the other people are doing. So we're going to use a bunch of different tools. We're going to give you some tools to go home with, and we expect you to do them. If not, then maybe you do have to come back more frequently. That's on, the onus is on you at that point. Like I used to treat a professional strongman athlete, the guy that lift all those crazy things. And so we gave him the tools, and then one day he's like, I'd just rather pay you to do this stuff. Okay, great. Like, that's fine. As long as he understands and we understand where we're at, then we can work with where we're at. So we want to blend it all together. We want to give you a treatment plan that ultimately puts the ball in your hands so that you have all the tools necessary. And then we just check in every once in a while, be your accountability buddy, hold you to your feet to the fire to do the stuff that only the people under this roof find sexy, so that you can do the actual fun stuff. You can work out, you can ride your bike, you can play ultimate frisbee, whatever your thing is. That's one of the things we believe firmly in, is that we want to ultimately shift your healthcare back to you.
Yeah, that's very similar with me as well, with my personal training. Like I'd love it if all of my clients eventually were like, oh, you taught me enough that I feel confident to be able to do this on my own. But there are people who are like, if I don't have that appointment with you, I know I'm not going to do it, and that's okay. So if you need me to go over with you, in person every single time, then that's fine. But if you feel ready to do that on your own, then that's awesome too.
Yeah, I think that's the biggest one we get here. I think generally people are pretty aware of kind of what a chiropractor was, right? They know their parents' chiros, the quick appointments and adjustment focused care, and so generally they're a little shocked when we treat them different than that. That's what makes it fun. I'd get pretty bored otherwise. If it was just the same thing every
They're probably like,
minutes.
what do you mean you want me to move and exercise?
We try and proactively make that a part of the conversation before they come in, so that people show up with shorts and are ready to move about and challenge themselves. But thanks, Dr.
Mahler, for taking the time to sit down and chat with me. So where can people find you
Sure.
and learn more about the Movement Co.
Yeah, so physically, our clinic is located on 4th Avenue, just off of Bank Street there.
Just around the corner from our
Literally
Glebe
just
location.
around, we're a block up the road, just past the Wild Oat there. So that's where we're physically at. You can find us at www.themvmtcompany.com. We're on Instagram, we're on Facebook. We have a small but growing YouTube channel. So we're pretty accessible out there. I think that covers it all. 613-237-4727 is the phone number. Yeah, reach out. We like to talk about what we do. We enjoy having conversations. So even if it's just a question like, is my so-and-so right for your clinic? Let's talk about it. That's fun.
We definitely look forward to working closely with you and sharing clients and
that'd be great.
giving everybody the best care that they need, right?
Yeah, that's where the fun happens.
Great.
Yeah, likewise. We've been really happy with connecting with you guys on a more involved level. So we look forward to continuing
Perfect.
that.
Yeah. Well, maybe we'll have you back on another episode of the podcast.
Great. That'd be great. Let's do it.
All right. So thanks for watching, and we'll see you next time.
See ya.